Imagine this, a patient is discharged from the hospital on a Friday afternoon. They can barely walk. No home care has been arranged, no follow-up appointment has been scheduled, and 6 hours later they fall in their bathroom and break their hip. They're back in the hospital by Saturday morning, and this time their stay is 3 weeks instead of 3 days. This is called an unsafe discharge, and it happens every single day in hospitals all around the world. Today I'm going to tell you why it happens, how to recognize it, and most importantly, how to protect yourself or your loved one. An unsafe discharge is when a hospital sends a patient home before they're medically stable, before proper support is in place, or before they're capable of caring for themselves. It's when the patients are told, you're ready to go home, even though they don't feel ready, even though they can't walk safely on their own or manage their medications or even perform basic tasks. And it's not rare, unfortunately. Studies show that nearly 1 in 5 patients is readmitted to the hospital within 30 days of discharge. Many of those readmissions are preventable and directly linked to unsafe or poorly planned discharges. So why does this keep happening? Well, there's a few systemic reasons why hospital discharge patients too soon, and none of them have to do what's actually best for the patient. So first is bed shortages. Hospitals are under enormous pressure to free up beds, especially during flu season, pandemics, or in understaffed facilities. If someone's sick or needs a bed, patients might be pushed out before they're ready. Third, staffing shortages. Nurses and doctors are overworked and overwhelmed. Discharge planning takes time, and when staff are stretched thin, it gets rushed or skipped entirely. Fourth, assumptions about home support. Hospitals often assume that patients have someone at home to help them, and they just assume there's someone there to help them cook, manage their medications. But if a patient lives alone, if they don't have family nearby or their home isn't accessible, those assumptions can be dangerous. None of these reasons excuse unsafe discharge, but understanding why it happens can help you push back. So how do you know if you or a loved one is being discharged too soon? Here are the red flags. Number 1, the patient can't walk safely. If they're unsteady on their feet, if they need assistance to get to the bathroom, or they're at a high risk of falling, they're not ready to go home without support in place. Number 2, pain isn't controlled. If the patient is still in significant pain and doesn't have clear pain management plan for home, that's a problem. Red flag number 3, the patient is confused or disorientated. If they're not mentally clear enough to understand discharge instructions or manage medications, they need more time or a different discharge plan. Number 4, no home care has been arranged. If the patient needs help at home, whether it's nursing care, physical therapy, or personal support, it should be scheduled before they leave the hospital, not we'll call you or someone will be in touch. Make sure it's scheduled. Number 5, no follow-up appointment. So patients should leave the hospital with a concrete follow-up plan. Who are they seeing and when? How do they contact someone if something goes wrong? Number 6, the patient doesn't understand their medications. If they're being sent home with new medications and don't understand what they're for or why to take them or how to take them, what side effects to watch for, that is unsafe. And red flag number 7, the patient doesn't have support at home. They live alone, if they don't have family nearby, or if their home isn't set up for their current mobility level, the hospital needs to know that before discharge. Here's what you need to know. Patients have rights during the discharge process. Patients have the right to a safe discharge plan. That means a plan that takes into account their medical condition, their home environment, their support system. Patients have the right to speak to a social worker or discharge planner. If there are concerns about going home, ask to speak with someone who can help arrange home care, medical equipment, or alternative discharge options like a rehab facility. Patients have the right to a patient advocate. Every hospital has either an advocate, an ombudsman, or a social worker whose job it is to help resolve these concerns. If you feel a discharge is unsafe, ask to speak to them. And patients have the right to refuse discharge. Yes, you can say no. If you don't feel safe going home, you can refuse to leave. Now, the hospital may push back, but they can't force you out if you're expressing safety concerns. So what do you actually say if you or a loved one is being discharged too soon? Here are some phrases to use. 1, I don't feel safe going home. I need a social worker to assess my discharge plan before I leave. That signals that you're serious and that you understand the process. Another thing you can say is, I need written confirmation that home care services have been arranged and scheduled. Don't accept vague promises. Get it in writing. Another thing you can say is, I live alone and I cannot safely manage things at home right now. What are my options? Be clear about the home situation. Don't let them assume that there's support. You can also say, I want to speak to the patient advocate or ombudsman or social worker about my discharge concerns. This escalates the issue and often gets results. And if they're still pushing back on you, can you please document in my chart that I expressed concerns about discharge being unsafe? Documentation creates accountability. If you or a loved one has already been discharged and you realize it's not safe at home, here's what you can do. Call the doctor's office immediately. Explain the situation and ask for urgent support. Contact the hospital's discharge planning department and explain that the patient was discharged without adequate support. If there's immediate danger, if the patient has fallen, they can't manage medications, if they're in severe pain, call emergency services or go back to the emergency room. Don't wait. Unsafe discharges are a systemic problem, but patients have power. They have rights and they have a voice. If this video has helped you, please share it with someone who's in the hospital or caring for a loved one. Drop a comment if you've experienced an unsafe discharge. Just let me know what happened. How did you handle it? Subscribe and follow for more patient advocacy tips. Everyone deserves safe, compassionate care, and don't settle for less.